Welcome to Dr. Mai, sharing medical knowledge. Today, we are diving into an essential topic, sleep disorders. If you've ever struggled to get a good night's sleep or feel exhausted during the day, this article is for you. Don't forget to subscribe, like, and comment on the topics you're interested in below the video to support the channel's development. Your input helps us bring you more valuable content. What are sleep disorders? Sleep disorders are medical conditions that interfere with your ability to get the rest your body needs. They can affect the quality, amount, and timing of your sleep. Everyone experiences occasional sleep difficulties, but you might have a sleep disorder if you regularly have trouble falling or staying asleep, feel tired even after getting at least 7 hours of rest, or find it difficult to stay alert during the day. Over 80 different types of sleep disorders exist, each impacting how well you sleep, when you fall asleep and wake up, and how long you sleep. These disorders can affect your overall physical and mental health. Major categories of sleep disorders. According to the International Classification of Sleep Disorders are divided into the following categories. 1. Insomnia, trouble falling and staying asleep. 2. Sleep-related breathing disorders, your breathing changes during sleep. 3. Central disorders of hypersomnolence, trouble staying awake during the day. 4. Circadian rhythm sleep-wake disorders, difficulty maintaining a regular sleep-wake cycle. 5. Parasomnias, unusual physical activities or verbal expressions while asleep, like sleepwalking. 6. Sleep-related movement disorders, movements or the urge to move that disrupt sleep. Common types of sleep disorders. While there are more than 80 types, some of the most common sleep disorders include chronic insomnia, difficulty falling or staying asleep most nights for at least 3 months. Obstructive sleep apnea, OSA, breathing repeatedly stops during sleep, leading to snoring and disrupted rest. Restless leg syndrome, RLS, an uncontrollable urge to move your legs, especially at rest. Narcolepsy, inability to regulate sleep-wake cycles, leading to sudden sleep episodes. Shift work sleep disorder, difficulty sleeping due to an irregular work schedule. Delayed sleep phase syndrome, trouble falling asleep and waking up at desired times. REM sleep behavior disorder, acting out dreams while in REM sleep. How much sleep do you need? Sleep needs vary by age, but adults generally require 7-9 hours of sleep per night for optimal health. Children and teenagers usually need more sleep. Sleep is a crucial part of maintaining good health, and chronic sleep deprivation can have serious consequences. Symptoms and causes of sleep disorders. The symptoms of sleep disorders differ depending on the type, but common signs include difficulty falling asleep or taking more than 30 minutes to fall asleep. Frequent waking during the night or trouble staying asleep. Daytime fatigue, frequent naps, or falling asleep during routine activities. Behavioral changes like irritability or difficulty focusing. Snoring, gasping, or choking during sleep. Causes of sleep disorders. Many factors contribute to sleep disorders, including medical conditions, heart disease, asthma, chronic pain, and nerve disorders. Mental health conditions, anxiety, depression, and PTSD. Genetics. Some sleep disorders are hereditary. Medications. Side effects of some drugs can disrupt sleep patterns. Substance use. Caffeine, alcohol, and nicotine use close to bedtime. Lifestyle. Working night shifts or irregular hours can affect sleep. Health risks of sleep disorders. Without adequate sleep, your body and brain cannot function properly. Prolonged sleep deprivation can lead to impaired cognitive function, difficulty concentrating, remembering, or making decisions. Personality changes, increased irritability and emotional instability, slower reaction times. This can lead to accidents, especially while driving. Chronic health conditions. Sleep disorders are linked to depression, obesity, type 2 diabetes, heart disease, and dementia. Some sleep disorders, like severe obstructive sleep apnea, can even be life-threatening if left untreated. Diagnosing sleep disorders. If you suspect you have a sleep disorder, a healthcare provider can diagnose the issue through 1. Physical exams and sleep history. Sleep diaries, recording when you go to bed, wake up, and how rested you feel. 3. Sleep studies. These involve monitoring your brain and body while you sleep to detect disruptions. You might also be referred to a sleep specialist for further evaluation. Treatment options for sleep disorders. Fortunately, sleep disorders are treatable. Some of the most common treatment methods include sleep hygiene, establishing a regular sleep routine and creating a restful environment. Cognitive behavioral therapy, CBT, a type of therapy that helps change negative thoughts and behaviors around sleep. Medications, sleep aids, melatonin supplements, or stimulants for daytime wakefulness. CPAP therapy, a machine that helps regulate breathing for people with sleep apnea. Light therapy, exposure to artificial light to help regulate circadian rhythms. Your healthcare provider will recommend a personalized treatment plan based on your specific condition and symptoms. Preventing sleep disorders. While you can't prevent all sleep disorders, practicing good sleep hygiene can reduce your risk. Tips for better sleep include: create a comfortable sleep environment. Keep your bedroom cool, dark, and quiet. Establish a regular bedtime. Go to bed and wake up at the same time every day. Avoid stimulants. Stay away from caffeine, nicotine, and alcohol close to bedtime. Limit screen time. Avoid phones, tablets, or TV before bed to promote melatonin production. Exercise regularly. Physical activity improves sleep, but avoid vigorous exercise close to bedtime. Living with a sleep disorder. Sleep disorders can affect your quality of life, making it harder to work, study, or even engage in daily activities. If you struggle with symptoms, don't hesitate to seek help. Early diagnosis and treatment can significantly improve your sleep and overall health. Remember, good sleep is critical for both mental and physical health. By working with your healthcare provider, you can find the treatment that works best for you. Thank you for joining us today on Dr. Mai, sharing medical knowledge. If you found this information helpful, please don't forget to subscribe to the channel, like the video, and comment below with any questions or topics you'd like to hear about in the future. Your support helps us bring you more valuable content. Sleep well, and take care of your health.